be available in the bookshop afterwards, and Professor Eubanks would be happy to sign copies as well. Monika, can you say something just so we can test that that works too? It's on? Okay, good. Great. I don't think you need to touch anything. I think
No, I needed to. Can you hear me?
Okay, cool.
Merci.
Merci beaucoup.
Can you hear me? Yeah.
The other headset is so that you can hear when we have the Q&A, and
yeah.
you may want to wear it while you're speaking.
Okay. Yeah, okay.
So whenever you're ready, you can go ahead.
Hi. Mine is not on. Is yours on? Do you have a? Yeah, mine is not on. I'm going to see if Kate can swap this out. This isn't on. Super. Merci.
Okay, should we get started?
We should.
Yeah, okay. Well, welcome everybody to our next Meet the Author session. We have a very interesting book and work to discuss here today, something that many of you will find surprising. I at least found it surprising. Part of this forum is about digital and the advantages of tech and all the great new fabulous ways that we can use technology in our daily life, in policy, in social policy. For me, that's a very important part of what we do with the OECD. I'm head of social policy, so I was very interested to see Virginia Eubanks' new book. Virginia is a professor from Albany University, and she has written this amazing book, I have to say, Automating Inequality. And she will explain to us today and answer your questions on how it could possibly be that technology might actually not be only beneficial to manage complex cases of social policy, but how it might actually be reinforcing many of the stereotypes and the difficult situations people are in when it's actually supposed to help them. So, Virginia, obviously the first question to you is, such a fascinating subject and so anti-mainstream, I might say. How did you get onto this issue, and what, for you in a nutshell, are the main findings from your book?
Okay. Bonjour, hello, hi. Thank you so much for being here. I'm excited to talk about the book with you all. And thank you so much for your hard work in bringing me here and having great questions. So I came to the work that became Automating Inequality, how high-tech tools profile, police, and punish the poor, when in the year 2000, I was sitting in a community technology center with a woman that I had done a lot of organizing with around both community technology and economic justice. She goes by a pseudonym in the book, and her name in the book is Dorothy Allen. And Dorothy and I were sitting in this community technology lab that we had designed together. We were just shooting the breeze about technology. And her electronic benefits transfer card came up. And that is, in the United States, a little debit-like card that your public benefits come on. So if you get cash assistance or food stamps, it comes on this electronic card. And we were talking about her EBT card, and she said, oh, yeah, there are a lot of things that are very good about it. But one thing that really troubles me is that my caseworker uses it to track all of my purchases and all of my movements. So everything I buy on this card, I'll go into a meeting with my caseworker, and she'll say, why are you spending your money this way? Why aren't you going to this grocery store? Why are you going to that grocery store? And I must have looked very shocked. I must have had this very shocked look on my face because she sort of laughed at me for a minute for being naive. And then I think very generously, she became serious and said, oh, Virginia, you all, meaning professional middle-class people, should be paying attention to what's happening to us, meaning moms on welfare, because they're coming for you next. So I've really taken Dorothy's lesson to heart in that there's this old line by William Gibson, says the future has already arrived, it's just unequally distributed. And I agree with him, but I think I mean it the opposite way, right? What he means, I believe, is that the future has already arrived, but it's rich people, wealthy countries that get the fancy tools first. And one of the things I argue in my book is that the digital surveillance future has already arrived, but it comes first to poor and working class communities in the United States and I believe also around the world. So that's sort of the origin point of the book, and that's where I got interested in the relationship between technology and public services in the United States, and that's why I spent the last 18 years studying how technology is being embedded in our social service processes in the US. So I tell 3 stories in the book. The first is about an attempt to automate and privatize all of the eligibility processes for welfare programs in the state of Indiana. The second is about a system called the Coordinated Entry System, which advocates call the Match.com of homeless services, and that's in Los Angeles County, California. And the third is about a predictive model that's supposed to be able to guess which children might be victims of abuse or neglect in the future in Allegheny County, which is the county in Pennsylvania where Pittsburgh is. So those are the stories I tell in the book. And following Dorothy's lesson, I tell them from the point of view of those families who feel like they're targets of these systems. So I talk to designers, and I talk to policymakers, and I talk to politicians, but I always start with the families who are feel most targeted and most vulnerable to these new tools.
So what's really interesting at the OECD, we often recommend to member countries that we should be harmonizing social policy more. We should have a one-stop shop. There's a famous example from New Zealand, for example, where the government was trying to reduce the problem of 5 cars down the drive, which means that a family in poverty often has complex needs, and they have different challenges to deal with. And so they're part of different programs, and each program has a caseworker, and the 5 cars in the drive means that there's 5 caseworkers all visiting the family, asking partly the same questions, partly different questions, coming to different conclusions, and not necessarily coordinating what they're doing. So we were thinking that having technology is a good thing, because then at least these families don't have to be subjected to all these endless caseworker visits, and the computer will, the algorithm, whatever the technology, will be able to find out what they need, and they will give them help quickly and targeted. Yeah. Now, what you find is that this is actually not the case, so I'm very intrigued to hear more about where the problem comes from. Why is this, which was probably a good intention, to make it more efficient and less onerous for the affected families and people, why isn't it working?
Yeah, so you've put your finger on a really important tension in the work. So in the United States, making it very difficult to apply for public services is one way that we keep people off of public services. And there is a budget line in many places in the United States for what's called diversion. And diversion just means making sure that people who are entitled to programs don't get access to their benefits. And whether it's intentional or not, one of the ways the system is set up is if you need many different forms of support. Say you need help with your home heating in the winter, and you need help with supplemental nutrition or food stamps. Often what that means is you have to go to one office that's in a very strange place in your city that's very hard to get to. You have to fill out a 40-page form. You have to wait in line all day long with your children. You're not allowed to bring food in. It's very challenging. And then you have to pick up and do it again for the next program, right? In another place, in another part of town. And so the potential here is for systems integration. And I think that systems integration can be incredibly positive, right? People should not have to fill out that form over and over and over again, particularly since they ask pretty much exactly the same information. And we should be able to view somebody's life holistically, not in these bits and pieces, right? And that's going to result in better outcomes for folks. But the challenge is, in the United States, and I'd guess in other places, but I can speak with surety about the United States, our system is also deeply implicated in the criminalization of poverty, which means making poverty illegal. right? So it means, for example, if you're unhoused, if you are homeless, many of the conditions of your day-to-day life are officially crimes. So sitting on the sidewalk in many cities is a crime. Putting your things on the sidewalk and not having another place to put them is a crime. Urinating in a stairwell is a crime, right? So many of the conditions of being poor are also things that can be criminalized, that can end up with you incarcerated. So the challenge, the tension in systems integration is this great combination of programs that could make it easier for you to access benefits and support, also means it's easier for you to be accessed. It's easier for you to be tracked. It's easier for your behavior to be traced. And it's easier to become caught up in the criminal justice system. And I'll give you one example. So the system I look at in Los Angeles, coordinated entry, requires a very comprehensive survey with a terrible acronym that I'm sure will not translate, but I'll use it anyway. It's called the VI-SPDAT. The Vulnerability Index and Service Prioritization Decision Assistance Tool. And the VI-SPDAT asks very personal questions. So it asks if you're currently having unprotected sex. It asks if you're trading sex for money. It asks if there's a warrant out for your arrest. It asks if you're thinking of harming yourself or someone else. It asks where you can be found at different times of the day. And it asks if they can take a picture. Now, this actually isn't a bad survey for identifying how vulnerable you are to some of the worst outcomes of being homeless, which includes death and mental breakdown and incarceration and horrible health effects of being unhoused. Unfortunately, people who are unhoused and who have undergone the survey also feel like they're being asked to incriminate themselves in exchange for a slightly higher lottery number for housing, right? So the challenge here is how do we make sure that there are policy blocks between the provision of housing services and criminal justice. And right now, those blocks do not exist in the United States. So under federal data standards in the US, police officers can access not all of, but some of the data from this survey with no warrant process at all, just based on an oral request. So they can walk into a social service office and they can say, I need information about John Doe. And the social service worker is not required to give it to them, but they're allowed to give it to them under the federal data standards.
So are there any movements against this? Because, I mean, if you look at the whole global movement now with social media data being passed on, and I don't want to name any tech companies here, but there's been a lot of movement and a lot of discussion globally around that issue. So what happens if you say no? And are there people kind of organizing protests? Because Or does just nobody know about what's happening with their data?
Yeah, so the question of whether or not you're able to say no is a really important question. So the case I just talked about in Los Angeles, for example, you sign a very comprehensive informed consent form so that you are officially volunteering this information. At the same time, coordinated entry, the system, has become the front door for almost all housing resources in Los Angeles. So it's hard to say that that's truly voluntary, right? Because the other choice is don't get housing. And so most people in that position will say, whatever, take all my information. I don't care what you do with it, just get me housing. So part of that informed consent process is a separate set of papers that you have to request that tell you who this information is shared with. So you don't get that when you first sign the informed consent. You have to go through a second process. It's very hard to get papers to folks who are unhoused, right? So that's really challenging. But if you do manage to get that list, it names 168 different organizations that share that information freely amongst themselves in Los Angeles County. So I think it's hard to say that people are truly volunteering this information. And I think one of the most important points in the book is that there are a number of established rights in the United States and elsewhere that should cover these kinds of interactions. Rights to privacy, rights to due process, rights to not self-incriminate. But if you are accessing public services, the assumption is that you trade those rights away for some kind of basic support. And so I think one of the movements that is really having incredible impact in this area is a movement that is trying to shift the United States from the kind of very punitive poverty programs we have right now to programs that are based on universal human rights. Because then the assumption would be you don't have to trade one right for another, because the right to housing, the right to education, the right to food, the right to health care would be guaranteed, right? So there's a lot of, I think, very hopeful work happening, particularly among organizations that are led by poor and working people around this work, though I don't know that we're articulating the data parts of those challenges yet. I think we're still learning that language, but I'm actually quite hopeful about where we are, even in the United States, because I'm seeing a lot of pushback on the kind of data collection that's been happening in community to folks who make their living collecting and analyzing data, right, is the sort of the Wild West days of data collection, where you could collect anything you wanted, keep it forever, and use it however you want, are over. And people need to adjust. Because I think even if we don't see something like the GDPR in the United States, that affected communities are already pushing back, already finding survival techniques, and that the way things have been working up till now, they're not going to work much longer.
I have lots and lots more questions, but it's called Meet the Author, so I want to give all of you the possibility to meet the author, so please raise your hand. We have a first question here, a second one here. Just a second, we have to put these things here on.
Just come around.
Okay. We need a microphone. Yes, you have one? Good.
Can you hear me?
Yes.
Hi. My name is Cheryl Miller. I'm rightly accused of being American, but I've lived in Brussels for 20 years and started something called the Digital Leadership Institute, promoting inclusive digital transformation. So I would love you to give us a bit of insight into the gender dimension in this equation, because I'm hearing, at least from the testimonies, that it's a lot of women who are impacted, and of course people of color.
Yeah.
Maybe we take two questions and then, yeah? And let's follow up with another question. No, here's a microphone. Oh.
Thank you. I am a Californian, and I live in Los Angeles right now. So I've been following the housing homeless issue. And can you hear me? 'Cause
yeah.
In my understanding, and this is just another way of coming at this same issue, that something called the Vulnerability Index was imagined maybe 5-10 years ago, I don't know how long, by Roseanne Haggerty, who is a homeless advocate from New York. And it was successful, I believe. I'm not coming at it from the rights point of view, although I'm a lawyer and I believe in protecting people's rights. The thing was that they realized that people were homeless. Nobody knew why. No one knew how to address it. So for the first time, people started asking, who is that person? Where are you from? And have you been in the hospital for a diabetes-related foot injury? And they ranked, I can't remember how many medical issues that had to do with whether you were going to die faster. And they gave priority on getting homeless accommodations to the people who were most likely to die first. And it was a really kind of a triage process. And then Los Angeles got interested in this and brought these people. They had more hotels converted to housing, and this was the push to get more people housed. So the feeling, the reason this was all happening was not to be invasive. It really wasn't to try to take anything away from these people. The reason that it was started was to try to help them live longer when no one was even knowing if they had a name or where they were from or if they had a relative, if they, whatever. It was not to be punitive. Now, what my question is, I believe you're both right. I think there's a way to use the vulnerability index and probably not, I felt this thing of this big, making it seem mysterious or something. I mean, I don't think it's designed to be invasive for the wrong reason, but for the right one. So my question is, how do you have a personalized system that accurately finds if someone is in need and helps them fill those needs, and also protect their rights?
Yeah, thank you.
Okay, two great questions. Start with the gender and then the attention and how to get to a good system.
Yes, so I heard, ooh, I'm getting some feedback, so I'm going to take this out. I heard 3 great questions in that, and I'm going to take each one of them really quickly. So there's a gender, race, and class question. There's an intentions question that was buried in the LA question. And there's also something that I want to say about triage, about this idea of triage. First, to your question about gender and about race as well. So my specific focus in the book is on economic class, and that's quite intentional because in the United States we love to pretend that we don't have classes. And so part of my intention is to help interrupt that narrative. I will say, though, that very clearly the folks in the United States who are most vulnerable to poverty are folks who are born poor, and that has everything to do with racial discrimination in the United States, and also people who are taking care of other people. And that, because of the way gender norms operate in our country, is almost entirely women. So I think it's really important to look at all of those things together. And I don't believe you can understand poverty or economic inequality in the United States without understanding race and gender as well, because they're so deeply caught up in each other. I will say one thing, which is part of the solutions conversation here is about interrupting the cultural narratives we have about poverty in the United States that create very bad policy responses. So the fundamental one is that poverty is an aberration, that it's something that only happens to a small percentage of probably pathological people, and that then becomes gendered and raced. The reality, based on Mark Rank's incredible life cycle research around poverty, is that in the United States, 51% of us will be below the poverty line at some point in our adult life, so between the ages of 20 and 64, and a full 2/3 of us will access means-tested public assistance. So that's straight welfare. That's not reduced price school lunches. That's not Social Security, right? So it is a majority issue that we have to understand through a gendered and race lens, right? So I think all of those things are equally important and deeply implicated in each other. But one of the stories we have to start telling differently is who poverty happens to. And the reality is it happens to all of us. It's a majority issue in the United States. So thank you for that question. And then this question about intentions. I really want to address this. So in the book, the first case I tell, the case I tell about Indiana, I think it can be argued that there was bad intention, bad implementation, bad outcome. Though I don't know what was in the governor's heart, it's pretty clear that if we had designed a system intentionally to divert people from public assistance, it would be hard to make one that worked better. This system created 1 million benefits denials in the first 3 years of the experiment, like a 50% increase from the 3 years before. But in Los Angeles and in Allegheny County, the second 2 cases I talk about in the book, all of the administrators, all of the designers, all of the social workers I spoke to are really smart people who care deeply about the folks their agencies serve and whose intentions are really, really good. And so that actually, I think, this is why I use them. These are the last 2 cases I talk about are actually some of the best systems we have, not some of the worst. And the reason that I use them in the book is because it then raises the question of, if we're doing everything right, if we mean to do well by people, why are we still producing systems that police, profile, and punish the poor? And I will say, from the point of view of folks who have taken that survey and who have not gotten housed, so they've surveyed 39,000 people as of the writing of the book, and they've managed to offer some kind of housing resource to 9,000. And that's not a house key. That can also just be the limited resources of something like rapid rehousing. For those 30,000 people who have taken that survey, often several times, and then face interactions with law enforcement day to day, they feel rightfully very suspicious about the motives of the system. That doesn't mean they're right. That doesn't mean that the motivations were bad, but that means you have to understand these systems in the context of the criminalization of poverty. It does not make sense, right, that law enforcement has access to this information under any other way of thinking about it. And then I want to make one final fast point about triage. So one of the things that every designer, every administrator, every social was that these systems are regrettable but necessary, that they're systems for triage because we have extraordinary need and not enough resources to go around. But what I want to remind people with the book is that the choice to triage is a political choice. I don't necessarily disagree with prioritization, but it is a lie that there are not enough resources for everyone. There are enough resources for everyone in the United States. So what I want to point out is that this idea that we have to triage is specific in some ways to the United States. In other places around the world, the kinds of things I describe in the book, people living on the sidewalk and having no home, families getting broken up because their parents can't afford a child's medication, so the state takes their children away, that would be seen as human rights violations. And in the United States, increasingly, we see them as systems engineering problems. And I think that says horrifying things about the state of our national soul and about the, our real commitment to ending inequality, economic, social, and racial inequality. Yeah.
Some more questions? No? Well, then I will take my privilege as the moderator and ask you a few more. You were just talking about understanding the systems. Who understands them? Because I can imagine the people who are most affected by this are poor people, and often we're also talking about digital literacy. And it's something that here at the forum, there's plenty of sessions also mentioning who is literate, who has the skills, and how do the people who are affected by this actually understand these systems. You have a fascinating example in your book where you and your partner had an issue with a medical insurance and you were going to be denied coverage, but you immediately caught on and understood why you had gotten into the situation and what you could possibly do about it. Now I can imagine plenty of other people have no idea even where to turn or for any reason why this has happened to them. So what's your experience with the people and the digital literacy?
Yeah, so since the writing of this book, I've been involved in a really fantastic project called the Our Data Bodies Project. And I just want to mention the folks who I work with on that project because they're all doing extraordinary work. So a woman named Mariela Saba in Los Angeles, Tawana Petty in Detroit, and Tamika Lewis in Charlotte, and my sort of co-principal investigator on this project, Sita Penyan-Gangadaran from London. And for the last 3 years, we've been talking to folks in some of the most marginalized communities in the United States about their experience with data collection, analysis, storage. And that's been 150 interviews and a national survey. And one of the things that's been really profoundly interesting to us is that people don't always have exactly the right words to describe what they're experiencing, right? So they don't necessarily know to say like, oh, this is a stepwise probit regression. But they do have really good instincts about what agencies have access to their information, how it's being used, and how it's being shared. So I actually think one of the most profound arguments in the book is that people like Dorothy, people who, like the woman I started this conversation with, actually know a lot about these systems because they're already living in the surveillance future, right? And so they're actually the experts in this work, and that it's absolutely crucial not to design from the point of view of potentially well-intentioned, but potentially out of touch folks who don't live in these neighborhoods. But it is actually really important to start with the most affected people, because my experience and our experience in our data bodies is that people know a lot about these systems and actually often accuse us of being really naive about how the systems work. So I might know the right language, like I might be able to say, oh, that's a this or that. But my experience is limited by not being day-to-day involved in these incredibly punitive systems that we see in places like Detroit and Los Angeles and Charlotte, North Carolina. Yeah.
And looking forward now, well, how do we get to a better situation? Because we talked a lot already about this trade-off, that it wasn't bad intentions that made it, that created these systems, but it's oftentimes we hear at the OECD also that people in member countries say, but you don't understand my situation. I don't actually need what the program is going to give me here. I don't need a certain service or a certain good. I actually need something else because my main problem is, you know, I mean, it's transportation, or I have to refuse a job. Why? Because I can't get there, or why? Because it's not that I'm not willing, or I have a disability which is so such an obstacle to doing this specific job. If you don't know all these things, or if people need childcare, or all these different issues that you actually, in order to do efficient and good social policy, should be knowing about people. Yeah. So how do we do this? Do we collect the data and then destroy it? Do we make rules that stops people from sharing it with a police system? Do we just forget about rules and give everybody the same benefit, which is obviously another big debate, universal basic income in the context of the digital world, where people are less and less attached to social security and social insurance systems which are based on employment. At the OECD, we've done some studies about it. Great idea, but unfortunately to do it well, and to have a really good system, it's going to cost a lot of money. And then the question is, you say the money's there, but maybe it isn't. So that to me is one of the big questions. I see that we have a question here now. Yeah. So maybe you start answering, and then we'll
get you the mic.
I'll give the floor to Virginia for a second, and then we'll take your question.
Yeah, so I think the key to the set of questions you're asking is exactly what you're saying about policy, which is how important it is to understand people's context is equally important to the design of technology as it is to the design of good policy, right? So that the conversations we have around, say, digital privacy are currently really I think oversaturated with questions about consumers of things like social media, and less interested in these questions of folks who whose context and situation makes it very difficult for them to exert their rights. Not impossible, it happens all the time. Movements rise and things change. But we have a kind of a focus, I think, right now in our technology policy that assumes a professional middle class, and often white, in the United States, user of the technology, rather than folks who are targets of technologies, rather than folks who are preyed on by technologies. And I really think understanding that context, understanding people's experience is an absolute first step to getting better policy and better technology at the same time. And I know that's a tall order, right? Like I've talked to machine learning folks who are like, oh my God, now you want me to learn history? And I'm like, yes, now I want you to learn history. There's a reason I use this metaphor in the book of the digital poorhouse. And I use that specifically to root these tools in their history, in the history of poverty regulation in the United States, because these tools don't just drop out of the sky, without any deep social programming attached. And so we have to be thinking on all of these levels in order to make good technology. Yes, that's very expensive, right? It's actually, we talk about these tools as being efficient and cost effective, but to build them well is actually quite expensive. To build them poorly is cheap, but only in the beginning. In the long run, it's very, very expensive to build them poorly, both to democracy and financially. Yeah.
We have a question now there. Yeah.
Jenny Grunsman, and I represent the Swedish Union for Graduate Engineers. And we are just starting to discuss all the data collected on employees by the employers. And we are, I think, pretty naive about it because we think they are good and that they won't do anything bad with it. But based on your experience, what kind of advice would you give us in this start of this discussion? What should we think about? What should we ask for?
Yeah.
Excellent
question. A great question. Thank you. So I haven't had a chance yet to talk about the data systems that I looked at as employment issues, though that is in the book. So I think one of the things that, again, is not intentional, but is not accidental, is that many of these systems are integrated into social services at the same time that public employees unions are being targeted. So for example, in Indiana, one of the things that happened with the automation and the privatization is that they moved 1,500 local county caseworkers from their county offices to these privatized regional call centers. So what that meant for them as workers is that rather than being responsible and accountable for a docket of families, for a group of families who were their families, they were only responsive to this list of tasks that dropped into their workflow management system. And so, and they were only responsive to the metrics that were in the contract, which were metrics like how quickly did you pick up the call and how quickly did you close the case, but not things like, did you make sure they get all the benefits that they're entitled to by law? So they saw, right, that it not only changed the way they were doing their job and the way they were being paid, but it also deeply changed their assumptions about their expertise, that they had expertise to offer in this process. And one of the things I talk about a lot when I talk about the book is we often talk about these systems as removing bias, particularly from frontline caseworkers. But it's really important to know that these systems don't remove bias, they just move it. And in the case of Indiana, they were moving it from frontline caseworkers, who are the most diverse, the most working class, and the most female part of the labor force, to the international team of data scientists and economists who are building the models, right? So the workers I spoke to often described these systems as de-skilling systems, and as systems that profoundly changed the kind of work that they were able to do, and changed the kind of relationships they were able to develop with the folks they were supposed to be serving. And that's pretty much across 2 out of 3 of the cases. That was a really big issue. So I think questions around de-skilling, questions around the valuing of expertise, and questions around the relationship, what I think of as relationships across the desk, so between folks who are caseworkers and folks who are applying for benefits, is the most important to me. But that's a portable question, right? Like, because it's a question about relationships between levels in an organization. Often these systems are used to collect information about employees that then mean that they have less power, less self-determination in their jobs. And I think that's incredibly important as a labor issue. Yeah, that's a great question. Thank you.
This reminds me of a film which got the prize in Cannes 2 years ago. Some of you may have seen it, I, Daniel Blake, which tells a similar story of automation and digitalization, and it's about this person who has a disability, and the algorithm expects him to work no matter what the doctor says, because the doctor's not part of the algorithm. And then he's trying to get on the computer because nobody helps him anymore. He has to do it on his own. And the job center lady actually wants to go and help him and is told, no, you can't do this. You're not supposed to help the clients anymore. They're, you know, we have to be efficient. So I think it shows you very nicely that this is not only a US issue, but it's something that we have. You're facing it in Sweden now. This is a great example from the UK, and I'm sure we have plenty of other countries with similar situations.
It's so much about the politics of austerity as well. So the idea that any relationship between frontline service providers and applicants for services, in Indiana, the governor saw that as an invitation to collusion, right? An invitation to collaborate to defraud the state. And I think seeing caseworkers and clients in that way really minimizes the legitimate needs that people have and the responsibility we have as a culture and as a society to help each other meet our basic human needs. So I think it really only makes sense, some of these systems, within the politics of austerity, within this politics that says we don't have enough, right? We can't invest the way that we have in the past. And I think we really need to push back on that narrative.
Yeah. We have a question here now.
Yeah.
Yes, I'm Helle. I come from Denmark. So I have a very naive question. So that could be, couldn't we use profiling for something positive? Isn't it because now poverty, it has a very negative sentiment, but we could turn it around and say, okay, profiling could actually be used to something very positive. So like in Denmark, municipalities use heat maps more and more to identify where could we find cases of potential molesting of kids or some other serious issues.
Yeah. So I love that question came, I think, at the end, because I do like to lift up systems that I think are doing incredible work. In the United States, there is one that I particularly like to talk about, which is actually a civil society organization called M-Relief, lowercase m, like for mobile. And what M-Relief does, which is really interesting, is that they help folks who are applying for public benefits by holding their data and not releasing it to the state until they've sort of pinged the system to see if you're actually going to be eligible. So one of the most frightening things, at least for my family when we applied for food stamps, one of the most frightening things is that you have to go through, 30 screens on the computer and you have to fill everything out before you can hit the next button. And then at the end, there's just a button that says apply. And you don't really know where that information is going to go, and you don't know how long they're going to keep it. And it asks some fairly invasive things, like how many refrigerators do you have in your house, and how many people live with you, and how many bedrooms do you have? And so there's this real moment where you're like, is this even worth it, right? Is it even worth releasing all this information? Because we don't know if we're actually eligible or not. So what M-Relief does is hold your information, and it checks the system, and then if you're eligible, it asks your permission, and then releases the information to the state. And they've actually had they do a lot of things besides that. They do some really incredible work. But one of the things they've had some remarkable success around is using their increasing sort of power and knowledge of the system to push back on the state in some cases where they're asking too much information, like information that's not policy relevant. So for example, in California, for CalFresh, which is their version of food stamps, one member of your household has to be a legal resident. And currently, how the state has been asking that question has been to say, list every single member of your household and tell us if they're legal residents and provide us with their social security numbers. That's not actually policy relevant information. They don't actually need to know that. They just need to know if there's one person who's a legal resident. And so M-Relief has actually pushed back on the state of California and has succeeded in getting them to remove that question from their forms, right? So of course, there's nothing about the data systems themselves that mean bad outcomes for poor and working people. And that's why I talk about it in historical context. It's like you do have to understand that these systems, unless they're built explicitly otherwise, unless they're built from this values position that believes that it's not just efficiency and cost saving that counts, but also dignity and self-determination and democracy and due process, that we're going to get technologies that amplify the inequalities we already have, unless we build it differently. And there are, of course, people out there building it differently. I hope my book contributes to providing people with the tools they need to think that through and to do that work. So thank you so much for that question.
Thank you so much, Virginia. You've certainly contributed to advancing our thinking at the OECD. I think we will really take those messages on board and take them forward as we consult with our member countries and make sure that when they build systems that they at least think about these things. And I'm sure we're going to have you back soon to give us even more details and more granular insights into what you've learned so that we can all benefit from this. The audience is still full, you see, although it's lunchtime. And so we're closing. We will let you all go for your well-deserved lunch. And I would like to ask you to join me in thanking Virginia for a fascinating discussion, a great book.
And I'm also signing books. I'm also signing books. Oh, if people are interested.
And she's signing books.
Yeah.
So
thank you so much.